Hi, in this video, I'm going to be talking about chemotherapy, how often you might get it, and for how many months. Also, I'll talk about how long each treatment is. If you're getting ready to start chemotherapy, you probably have lots of questions about this. And if you're watching this to support somebody you love, same thing. So chemotherapy, we've talked before about what to expect in other videos about how chemotherapy is given, but I'd like to review that briefly here. In general, chemotherapy is given by IV or by mouth. We also give other medications that aren't strictly chemotherapy, they're anti-cancer therapy. So I think I'll talk about both of those together. So when we give chemotherapy, we usually give it through a vein, that through an IV, that can be in your arm, or through a more long-term semi-permanent IV in your arm, or through a port. And that's a semi-permanent IV that actually goes under the skin, and you'll have an incision about this long. The port might be raised up depending on how much soft tissue you have in this part of your body. It might be the size of a stack of 4 or 5 quarters, or it may be completely flat with your chest. And that allows a tube to go into the large veins in your chest. It's usually done with X-ray guidance, so the surgeon knows exactly where to put it. It's done under local, although you might be more twilight where you're more asleep. If your veins are difficult, or if you had lymph nodes removed on both sides of your body, having a port makes a lot of sense. It also makes a lot of sense to have a port if you'll be receiving targeted therapy like trastuzumab, which we give over the course of a year. You can imagine getting an IV put in your arm every 3 weeks for a year could be really hard on your veins. It's not necessary, but most people find it's helpful. You do not need to have the port put in before you start chemotherapy. If you find that your veins are having a tough time with treatment, you can have a port inserted really at any point. So when chemotherapy is given, you're treated in an outpatient setting in the vast majority of cases for breast cancer. Your nurse will get into that vein either through an IV or a special needle that goes into a port. It's actually angled, so it goes right in there. You can have some ice put on the port to help numb it up a little bit. The IV will go in, you'll get anti-nausea meds or other medications to prevent side effects. You can get those by IV or by mouth, depending on the particular drugs. And you want to make sure that you accept any drugs that are offered to you, because even if you feel great that day, we're trying to help you feel good the next few days as well. Then after the chemotherapy is given, the needle comes out and you go home. You rarely have to go home with the IV kept in place. There are some exceptions where people are getting multiple days of treatment in a row, and it's just nicer for them to keep the port accessed, is what we call it, for a few days. Chemotherapy, each treatment will take somewhere between, I'm going to be on the generous side here, between 2 and 8 hours, depending on what you're getting. So if you are receiving a regimen that has 2 chemotherapy drugs and targeted therapy or 2 targeted therapies, I would plan on being there most of the day. If they get you out more quickly, that's found time. But for my patients, especially with the first treatment, I tell them, plan on being there most of the day. Don't plan on being somewhere after treatment. Make arrangements for your kids or other responsibilities so that they have time to make sure you understand what to expect. They go slowly. You don't feel rushed. You don't feel like you're in and out like this. They can redo any teaching, answer any questions you have. As your cycles go along, it will be probably more streamlined. You'll know what to expect. You might have your blood work done the day before so that your time actually in the infusion center is shorter. It really depends on the recipe or regimen that you're getting. Now, we talk about cycles. You heard me say the word cycle. When we talk about a treatment, we talk about giving a certain number of cycles. And we call it that because you have your day 1 treatment, and then you kind of cycle through your side effects. Those side effects can be most severe in the first couple days after treatment. Your white blood cell counts will be lowest in the middle, right here. and then you will start to recover from chemotherapy. And then you will get your next cycle. So the cycles kind of go like this, if you want to think about it that way. When I draw it out for my patients, I also draw a vertical line like this and then a horizontal line in between. The time between those treatments, the frequency between, let's say, your first treatment and your second treatment can be as short as 2 weeks or even 1 week, depending on the particular regimen you're getting, or it might be every 3 weeks. If your white cell counts are low, you're not tolerating treatment well, and you need another week to recover, that duration might be extended. We try to keep your chemotherapy on schedule for lots of reasons, to help you plan for your life, and also because in some tumors, maintaining what we call dose intensity, the right doses on time, is associated with better outcomes. That's not the case for all cancers. It really depends on the features of the tumor. If you need an extra week to recover, it's very likely that your body is seeing higher doses because of how you metabolize the drug. So let's say you metabolize the drug in a way where it's hanging around in your system longer, and that means we have to delay your chemotherapy another week so that your white count can recover, so the rest of you can recover. It's very likely that the tumor cells are also seeing that chemo hanging around longer. So I don't want you to be concerned if it's taking longer for you to get your chemotherapy in. It can be quite a nuisance and very disruptive. But in terms of your prognosis, taking longer to get through chemotherapy, as long as you're tolerating it, has not been shown to worsen your outcome. Again, your body is seeing effectively a higher dose. It's hanging around longer, and so most likely are any residual tumor cells in your body. I'd like to talk about oral therapy right now. If you have advanced disease, or if you're getting additional chemotherapy after your initial chemotherapy, we do have a lot of medications now that are given by mouth. And those are often given every day by mouth. And then you see your medical team every 3 weeks or every 4 weeks, or if you're doing very well, every 2 months. There are also some oral therapies where we'll go 2 weeks in a row followed by a week off. And in that week off, the chemotherapy or anti-cancer therapy is actually doing its work. So you're actually not skipping chemo. You actually may see more side effects in the week that feels like you should be not getting any. So it's the way your body handles the drug that means you need that rest period. I'm focusing on this because some people feel that they should just stay on the medication and not take that week of rest or omission of the therapy. And that's actually not prudent. It's very likely you'll end up coming off the drug altogether sooner, because those side effects, whether you feel them physically or the effects on the body, will accumulate. The other thing I want to talk about is not skipping doses because you can't afford your medications. We know there are people all over the world that will take daily medicine every other day to spread it out because they have a hard time getting the medication paid for. In some diseases, this has been shown to decrease survival. So I'm not talking about decreasing the dose or frequency of medications because of side effects. I'm talking about other reasons like finances, or maybe you have a tricky relationship with the medication. You don't like it. You're not quite, comfortable being on it. I would strongly advise you to talk with your team, to reach out to support groups, to look into grants. Your social worker can help you find ways of paying for your medication. So it's really important to take it as prescribed. This is for the oral medications, because IV medicines, we know whether you're there or not. With oral medications, it's a lot harder for us to know if you need additional support. I've covered a lot. I've talked about how we give chemotherapy by vein or by mouth, how often, how long it lasts. So it will last somewhere between 3 and 6 months, the chemotherapy itself. Anti-cancer therapy, like targeted therapy, can actually continue for a year. And we do have videos that talk about how we treat stages 1, 2, and 3 breast cancer with a lot of detail on how treatment is given. So I would encourage you to watch those to learn more. I hope this has been helpful. If it has, click like and subscribe. Drop us a comment below or question. We try to get back to you as soon as possible. And you can go to yerbba.com to get your personalized report and learn more about what you might expect as part of your treatment plan.